Hey guys, I'm Harry. I'm a second year occupational therapy student here at Monash University down at the Peninsula campus. I'm also the president of the Society of Occupational Therapy, or we call it SOOT. And today we're here just to talk to Yaser and Ange, a couple of graduates from the class of 2016, about what their career looks like and how they've gone about it. So can you guys tell everyone a bit about yourselves? Maybe start with you, Ange. Where are you at now and how did you start and how'd you get there?
Yeah, sure thing. So I guess I was at Monash from 2013 to 2016. So I graduated at the end of 2016. I was very fortunate that I got my first job out of uni at the Royal Melbourne Hospital, and I've been working there ever since. I'm currently working in a geriatric setting, helping the aged population to get back home after they've been in hospital, which is a really rewarding area and hopefully an area that I'll be able to stay in for a while longer.
And Yaser?
So at the moment, I'm working at Monash Hospital. Working for Monash Health at Dandenong Hospital in the hand therapy department, which is part of the outpatients area where we essentially treat patients who've just come out of surgery or had any sort of trauma to their upper limbs. Prior to that, my OT career started in aged care. It was initially more of a pain management program where we were essentially helping them with any of the forms of deconditioning that occurred while they came into aged care. Shortly after that, I left and became a hand therapist at a private practice. And that was just in a private clinic on my own where I was treating people who are mostly work cover related injuries for their upper limb.
And we might start with you. What would you say is the most rewarding part of being an OT and especially your role at the Royal Melbourne?
Just being able to help people achieve their goals that they might not necessarily think they can achieve. Through all of my rotations, I've definitely had standout moments with specific patients. Within my current role, it's really about helping people to get back home when it might be perhaps their last opportunity to do so when they're unwell, and even just coming up with new ideas for how they can complete their activities of daily living that they might not necessarily have thought of. That's the biggest part, and really being able to make a difference in someone's life and have then, patients themselves and family members be really grateful for the input we've been able to have is really wonderful.
What would you both say, maybe start with you, Yaser, would be your most important skills that you need to succeed?
Definitely adaptability is quite an important skill to have. So that's kind of being an OT, we are expected to get into an environment and not exactly know everything that there is to know about that particular field. That's definitely not what is the expectation of us, but be able to sort of pick things up and assess the situation and take things from there. So I guess learning how to learn is a huge aspect of being an OT, as well as research. That's another thing that was drilled into us at Monash. The field that I'm in now at Monash Health, our treatment is very research driven. And in order to know exactly what we're providing to our patients, we need to have the research to back that up. And knowing how to research, that skill that is very heavily emphasized at Monash University has done wonders for me since graduating, I would say.
How do you think that Monash and the Monash program has prepared you for your career and your success that you've had already?
I credit a lot of my success to Monash. So as I just mentioned, the SBLs and having different conditions that we learnt about each week and how the OT role might apply to that has always been really beneficial. And the diverse range of placements that I was fortunate enough to have while I was at Monash, particularly my finding new placements in hospital settings, which is where I've ended up working and I think is probably where I'd like to continue working for quite a while. I still hear of, the lecturers that we had now. I hear, see research that they're coming out with and hear about them presenting at conferences, and having those working relationships I think is really important as well.
Look, thank you both very much for your time. You've certainly given us a lot of insights and given everyone watching a lot of food for thought, and hopefully we've got some future OTs watching along with us. And if OT is for you, it'll be good to see you down on campus at the Peninsula.